Hi, my name is Sybil Calhoun, and I'm here today to propose a business plan for the Carilion Pediatric Cardiology Clinic. The pediatric clinic is located in Roanoke, Virginia, and the mission of the Carilion Clinic statement is to improve the health of the community we serve. This new position would support the mission statement by providing better patient care, improve the health of the community, and lower the cost by having a permanent pediatric cardiologist versus a locum tenens. Currently, one pediatric cardiologist has retired and another one will retire within 6 months. In order to improve the health of the community we serve, we need 4 full-time pediatric cardiologists. Congenital heart disease is the most common birth defect in the pediatric population, and despite advances in prenatal care, babies continue to present with severe congenital heart disease. Older children also need the follow-up from the repair that they've had, as well as the evaluation of their disease. The need continues to increase each year for pediatric cardiologists. The short-term goal would be to hire locum tenens until we could find a permanent pediatric cardiologist. This is expensive because locum tenens are expensive, and the local community needs and requires that we keep 4 full pediatric cardiologists to keep the clinic going. The long-term goal would be to hire a permanent pediatric cardiologist. Sometimes it can take up to 2 years to have a pediatric cardiologist in place and look for the search for them, and then the credentialing process that goes along with that. The market analysis, the plan will affect the local community as well as within a 100-mile radius. Over 200 patients will be affected annually if this position is not filled. This would also affect the market share if the position was not filled, because Lynchburg currently has 2 pediatric cardiologists there and can very easily market in our area and draw those patients to Lynchburg. The norm and outlook for hiring new pediatric cardiologists, as I've talked about before, takes about 2 years. The practice has had some growth in the last 3 years of about 6%. The competitors are University of Virginia and Centra Health. Both of these healthcare organizations have pediatric cardiologists. UVA offers pediatric cardiology surgeries as well as the non-interventional methods. The Pediatric Cardiology Clinic can target customers with information about the new pediatric provider through strategic management, which is a department that solely markets new services through television and social media. The marketing department can conduct a market analysis to see what areas of the local region should be reached more effectively than others. The pricing and charges for an additional provider would be minimal. The clinic is already there. The office is already there. The visits and inpatient visits are already priced. The Pediatric Cardiology Clinic is already in place, as well as the main focus of advertising for a new provider, and any different procedures that he or she may do may add to the volume. The organizational chart would not change. There is currently a vice president for inpatient and outpatient pediatrics, the director for outpatient and a director for inpatient pediatrics, and a manager for the Pediatric Cardiology Clinic. The employee skills would not change. There are currently nurses and front desk staff in place. There may need to be another nurse hired specifically for this pediatric cardiologist. The only other procedures that the clinic does at this time are echocardiograms. They do both the pediatric echocardiograms and the fetal cardiograms. An additional room may need to be added for a second echo room, and another tech may need to be added as well. The historical financial data that supports adding a new pediatric cardiologist. The monthly gross revenue is around $480,000. In order to keep the existing revenue, the fourth cardiologist must stay in place. If a new cardiologist was trained in extra procedures or could go to additional satellite clinics, then the revenue would increase. The 3-year projection plan would remain flat unless additional procedures or clinic areas were established. Expenses, the annual salary would be around $300,000, the laptop would be $2,200, cell phone around $400, and the revenue annually for the total clinic would be around $5,760,000. There are no capital costs. The clinic equipment, staff, and physician already exist. My proposal would be to hire for an extra pediatric cardiologist. Thank you.